Hi everybody, welcome back. Hope you had a great long weekend and you got some downtime. And I also just wanted to say, since this is my first video since I've been back from my trip, to thank everyone who helped to make my sabbatical possible. It was really great after 12 years to be able to have an opportunity to recharge the battery and come back ready to do good work. So I have a number of things to talk about in this video. The first thing that I really want to talk about is HOSTA grants. I know there's been a lot of questions, and we have had a preliminary conversation with HOSTA, and we do believe that most of our prevention grants, if not all, should be renewed, but we haven't had those letters yet, and we'll be pestering them ASAP. Those grants would end normally the end of September, and so we want to make sure that we have those in place. And so I promise to be communicating as quickly as we can about all the news. And again, our preliminary conversations with them said that we didn't have much to worry about. Now I want to talk a little bit about HOSTA grants, but really in the context of healthcare reform and the impact it's going to have on us. We talked about healthcare reform now for more than a year and how it's going to impact us. And we're starting to see some of that. And probably the best example is really what's happened in clinical services. So, one of the things about healthcare reform is this idea of the patient-centered medical home. What that says is it ideally puts the patient and health outcomes, so a healthy patient, fundamentally in the center of treatment planning. What the medical home allows things to do, where a medical home is a little bit different, is it allows the doctors to actually engage in broader networks of services for the patient as long as it helps to improve the outcome. And there is a lot of room for groups like Metro Teenage to be part of that. I think one of the main differences is that historically our Ryan White funding came to us, and we could work with any young person regardless of where they were getting their care. Now, if assuming we get funded, rather than apply for Ryan White ourselves, we actually apply to under Whitman Walker and Unity and Howard. So, assuming that they get funded, we'll be looking to them to work with their clientele. And if anybody new comes along, we'd have to figure out a negotiating a rate with them. So things are a little bit different, but we hope to hear about that soon as well. And I think from the idea of really trying to get to the outcomes to make sure that there's suppressed viral loads, that young people are as healthy as they possibly can be, there's a lot of opportunity for us to also do a lot of great work. Um, the other place where I think healthcare reform, which is interesting, is taking effect is in the health benefit exchange. So where we have traditionally gone to get our health insurance from an insurance broker who did all of our liability and everything else, but also our health care, at some point in the next year or two, we will probably move over to the health benefit exchange, as will most what they call small employers, so people with less than 50 employees. We don't yet know much about the cost differences. What we do know, or what I do know, is that from our conversations with them, they're trying to build a system that they're talking about, like an Orbitz-like system. So you'd be able to actually go in, or we'd all be able to go in, and rather than just have United Healthcare one model, you'd actually be able to choose healthcare plans from maybe among 50 or more plans. And so you could look at, people like me, my back always hurts, so I want to make sure physical therapy is well covered. And so I might look for a plan that has adequate coverage for that. For other people, acupuncture or alternative medicines might be important, and so there might be offerings there as well. So there more to come on that, but that probably should come down the pike in probably the next year or two. And finally, what I want to say is that healthcare reform is going to change how we as a country see HIV. In many cases, HIV is being mainstreamed into these broader healthcare systems. In other ways, HIV is actually being looked at as a model of how you do comprehensive care, where you really do the community wraparound services in the ways that we do. But fundamentally, there's going to be change, and what I want you to know is that I feel more confident than ever. We have an incredibly strong group of program directors right now, which I'm very excited about, and they, along with Craven and Shelley and myself, are sort of reconfirmed as the leadership team, and coming back from sabbatical, we were trying out a new meeting structure and a bunch of other things to make sure that we have the strongest team possible. And I want you to know that that team is also working with the board to make sure that we put Metro Teenage in the best possible position through all of these changes to make sure that we can provide the highest quality of services for young people and that we can stay strong as well. So um, feel free to ask me more questions. There's a lot of learning here to do around healthcare reform. But again, I think as we've talked to people, we're well positioned to do well. Um, but change is never easy. So please ask me any questions. Ask certainly Craven or Shelley, and we'll continue to talk about this. Anyway, welcome back, and I hope you have a great week. Thanks.